When patients use the Hendrick Breast Institute, they have someone that can meet their needs all the time, whether it be questions getting ready for the biopsy. Am I allowed to eat? Am I allowed to wear deodorant? Or if you have breast cancer, who do I see next? When's my next doctor's appointment? You'll have someone with you through the entire process. From the day you need a breast biopsy to the day you get to hear the word, you are now cancer-free. We will be there for you the entire process.
And you have somebody that is there to answer your questions, to give you the guidance that you need, to give you the support that you need.
A breast imaging nurse navigator is a nurse who specializes in breast imaging. So I'm here to help you if you're getting a screening or a diagnostic mammogram and you might have questions. My goal is to make that transition through your mammogram process as easy as possible.
You have someone that is there with you every step of the way to the best way that they can.
If your biopsy results come out benign, wonderful. We'll send you a letter in 6 months reminding you to get a follow-up mammogram. That's just to establish a baseline on that side that we did the biopsy on. If your results come back malignant or cancerous, you will meet our cancer navigator. And she has walked this journey with so many patients, and she will be there for you for everything you need through your cancer journey.
So after they get a biopsy, and if it comes back malignant, then I am made aware of that patient. And so I usually start with a phone call, just kind of introducing myself to them that way. And then after that, I connect with them face to face, whether that be at an appointment to meet their surgeon or the day of surgery, or if they have to see an oncologist first, then I meet them at their oncology appointment. And then we just go from there.
I typically meet our breast cancer patients the first time they step into the cancer center's office, when they first meet our physician over here. I can meet them in the hospital if they get diagnosed in the hospital or we are starting treatment in the hospital, but typically I meet them at their first office visit. The Hendrick Breast Institute comes in play from step one. And so often they are already in tune with their nurse navigator over there. They already have so many resources and they're less anxious overall because they've already got tied in with the nurse navigator and they feel like they already have this team of cheerleaders.
Another benefit are the resources that we can plug them into. So if they need help with gas money, then we help get them resources for that. If they need a place to stay, we help with that.
There are things that we can do now that we have the program in place that are available to all patients, whereas maybe before they were kind of hit or miss or kind of individualized, but now we are able to offer those services to all patients.
I would say to anyone that might be new in their journey of breast cancer, just to know that this is a huge team. So not only do you get just a nurse, but then you get, again, doctors and techs and all kinds of people working for them. And to know they're not alone. We plug patients in with past breast cancer patients, so breast cancer survivors, and help them kind of figure out what to do from here, because I've never been through cancer. So I can try to empathize all day long, but I've never been through it. So having someone that's been through it, that has been a huge help for patients that are going through it, just to be able to talk through, what to expect and what's normal, and especially with emotions and dealing with all that. Because a lot of times patients feel like they have to be calm and they can't cry and they can't, let their guard down. And I try to tell them this is a journey for them. And so they are allowed to grieve and they're allowed to be mad and cry and all of that. But eventually at the end of the day, they're going to get through it and they're going to be stronger for it.